Hi everyone, welcome to our brief. Over to Richard Mitchell.
Thank you. Good evening. So I'm Richard, I'm the Chief Exec here at Sherwood Forest Hospitals. As you probably know, at Sherwood we run 3 hospitals. We've got the hospital at Kingsmill, where we are today. We've got Mansfield Community Hospital and Newark Hospital. Really grateful that today you found the opportunity to join us for our 3rd virtual brief. Really through this we want to convey an update about where we are in terms of being a provider of hospital-based care. We're going to do a round of introductions first of all. So to my right.
Good evening, David Sowen. I'm the Medical Director here at Sherwood.
Hi there, I'm Julie Hogg, Chief Nurse.
Hi, I'm Simon Barton, Chief Operating Officer.
We have 2 colleagues joining us as well. So Andy, can you introduce yourself?
Hi there, my name's Dr. Andy Haynes. I'm the Integrated Care System Lead for Nottingham and Nottinghamshire.
Thank you, Andy. And Jane?
Hi everyone, I'm Jane Lawton. I'm the Chief Executive of Healthwatch Nottingham and Nottinghamshire.
Thanks, Jane. And Robin, do you want to introduce yourself?
Hi, yes, of course, I'm Robin Smith. I'm the Acting Head of Communications for Sherwood.
Thank you. So we've run 3 of these. I think they've worked fairly well. This really is an opportunity for us to update on where we are, but mainly for you to ask any questions that you can do. We've mentioned it previously, just for the avoidance of doubt, we can't pass comment on sort of individual care plans. So if you could ask sort of generic questions about things that are going on or areas where you need assurance, we can certainly answer those. As we've done previously, anything that we may not know the answer to, we will come back to you afterwards. But as we find, all questions genuinely are great questions because they enable us to understand how patients and the community feel at the moment. We've planned this for the last couple of weeks, so it's just by coincidence today. Unfortunately, as you have probably heard, it's been confirmed that the county of Nottinghamshire will be going into Tier 3 lockdown on Friday. And I thought, Andy, in your role, you'd be best placed just to give us an update on that, please.
Yeah, happy to do that, Richard, thank you. So people will be aware that the rate of infection has really increased very rapidly over the last few weeks in the county of Nottinghamshire. It started accelerating in the south of the county, but it's fair to say now that around Mansfield and Ashfield the rates are really accelerating, and particularly in the over 60s. And that's really important because we know that the majority of patients admitted to the hospital will be over 45 and predominantly over 60. So that's likely to drive pressure on the hospitals. The other thing that it's important to reflect on is that what we see in the hospitals today is reflecting what was happening with transmission of the virus 3 weeks before in the community. So there's a lag. So we know that that pressure will continue for the next 3 weeks. So it's critical, I think, that we act at this point in time to try and reduce transmission of the virus, particularly into that age group over 60 and the vulnerable patients that can be in that age group, in order that we can minimise the size and the duration of this peak as it runs through our health and care system, so that we can continue to deliver safe care to both patients who have COVID and those patients who don't have COVID. So I think it's important to understand that time sequence, and the restrictions that will come in place are added on to then the measures that you'll all be aware of. So we know in that over 60s age group, household mixing between different households and public transport are probably key factors in transmission, and therefore we'd ask people to avoid household mixing wherever possible, to follow the hands, face, space, but really commit to it, not just pay a token gesture to it, particularly around public transport, and then to follow the restrictions, because if we do that, the hope is in 3 weeks' time we'll see falling rates of infection, particularly in the over 60s, and that will help take the pressure off the hospitals as we build to and start to plan for winter. I think that's how I'd summarise it, Richard, if that's okay.
Perfect, thank you, Andy. And what I think I'm hearing for you is one about the importance of collective effort, recognising individual responsibility.
Yeah, we all have to do this. It's not something that we can leave to somebody else. Yes, the infections sort of began in the younger age groups, but it's clear now that they've spread beyond. So to cut the fuel off, if you like, for this epidemic, we need to reduce the transmission rates across the board. They are falling in the younger age groups already, but we now need to see them fall in the older age groups and look after those more vulnerable people. So we individually have a responsibility. Our partners in health and care have a responsibility. So I'd really ask the public now to get behind this and support it. It's not ideal. None of us would want to go back into more restricted lockdown, but we think it's pretty critical so that we avoid the health and care system becoming overwhelmed in 3 weeks' time.
Thank you. So that provides a bit of the context about what's happening across the county. As I said, if you've got any questions that tie into what Andy has said, please begin to ask them. We'll do a bit more of an update and then we'll come on to them. But now, if I can ask you, Simon, to give an overview from where we are from a Sherwood perspective, Sherwood Forest Hospitals.
Yeah, so I think there are just a few things that I wanted to say around that, which firstly is we are seeing increasing numbers of patients who are COVID positive are being admitted to the hospital for care. But notwithstanding that, at the moment, we are continuing with the vast majority of our service offers to other patients. And I think that's really important, and that is different to what it was like in the spring, where people will be aware that there are a number of services that were paused around that. So I think we remain open, and we urge you, if you're feeling unwell, to still come to your appointment, still come to the hospital if you feel you need treatment. And we want to try and maintain those service offers as much as we can, but you'll also be aware that our workforce is very stretched as well around this, and no different to anyone else in the population in terms of having to isolate and things like that. But so I think the overall message is that we remain open at the moment for all our services.
Thank you. And we know that whether you walk into the hospital at Kingsmill or Newark or Mansfield Community Hospital, we know during leave that it looks different at the moment. There's different expectations on patients and visitors. Can you update us on that, please?
Yeah, of course. So for our inpatients, we're operating the designated visitor policy, which means that each patient can have one visitor for an hour each day throughout their stay. There are some restrictions on this, for example, where we've got patients who are COVID positive or patients who are staying within certain areas of the hospital. We'd encourage you to have a conversation with the ward leader before attending the hospital. From a maternity perspective, we are doing our best to keep women and their partners together. So partners are welcome to attend the 12 and 20 week scan. They're welcome to accompany women to their induction of labour, caesarean section or labour, and are able to visit the maternity ward afterwards. And both parents will have unrestricted access to the baby if the baby is admitted to the neonatal unit. We've got compassionate visiting policy in place for anybody in our hospitals. So if there is a reason for us to operate a compassionate visiting policy, we will offer that to you as well. Our one ask of you is that you follow our visiting rules. We can only keep these visiting policies in place if you follow them and don't arrive at the hospital if you've got symptoms of COVID, or if you have household members that are isolating because of COVID. So that would be my one ask of you.
Thank you. And sorry, Robin.
I wonder if I can just pick up on it. We've had two questions from the comments around maternity. I think you've covered most of it, Julie. So can we be really clear? Are we making any changes as a result of moving into Tier 3?
We aren't. We are maintaining our current visiting policy within maternity. But please don't arrive at the hospital unless you are the partner of the mother or the chosen birth partner. We are going to ask you to wash your hands when you arrive at the hospital and wear a face mask. If you don't do these things, you won't be able to attend the hospital. You will also need to socially distance from the individual that you're visiting. It's really important that you follow these rules to keep everybody safe.
Fab, thank you. And I was going to ask you, Dave. So we had a conversation earlier today about just recognising the pressure that people within the hospital are under, the colleagues. And we know that some of our communication is about collective responsibility, looking after each other, looking after ourselves. We know that people who work in the organisation are also patients in the organisation. got strong links with the community. So question to you, and sorry for not raising it in advance, but do you want to just touch on a little bit about some of the pressure that people in Sherwood Forest hospitals are under, and therefore why we need the public and patients and the community to sort of be responsible and receptive to people here doing the best they can do?
Oh, I think members of our team, members of our staff, reflecting what much of what is felt throughout our community, really. People have found this year difficult. Don't need me to tell you that. We had tremendous challenges going through wave one, phase one, the spring, and similar to everyone out there, all of our public. The summer was difficult because we couldn't all go away on our summer holidays, perhaps as we anticipated. And we haven't really had a break. People are tired. They've worked solidly all year. We put plans in place trying to prepare for a second wave that has come perhaps slightly earlier than we anticipated. Of course, we knew winter pressures would come as we see an increase in activity, but we've had obviously this increase in COVID activity as described by Andy and Simon. People are just finding it all really quite difficult to deal with. And of course, we've gone into now, the clocks have changed, we've gone into darker in the evenings. People are worried about us going into the tier 3. There's this concern about what on earth is going to happen on Christmas, where we're going to get to, what the new normal is going to look like, all of those aspects. And I think it's there's a palpable, I don't think it's frustration, but just concern of what's happening. And of course, that's just within our work, but also within our home lives as well. We all have families, we're all concerned about the families. So all of that is completely understandable. Like Julie, I mean, my ask would be, and people talked about the collective responsibility. The messages are quite simple. It's about hands, face, space. They're relatively simple. It's about washing your hands. It's about wearing the masks. But most importantly, perhaps, it's about keeping that distance and socially distancing. And we're trying to really enforce our, encourage and enforce our, empower our staff, I should say, to challenge people who are not obeying that, be that our staff or be that visitors, but also to live those values, not just in their work lives, but of course at home.
Perfect, thank you. And Jane, anything you'd like to add to the conversation at this point?
I think I'd just like to explain to people what Healthwatch is, in case you're not aware. So the reason I'm here is because Healthwatch is the independent organisation in Nottinghamshire that represents patients and the public. And on your behalf, we hold health and care providers to account for listening to local people and using their feedback. So, you know, we really support this event. This is you know, is a fantastic example of what listening to the public looks like. We welcome these events, but I'm also here to, you know, act on your behalf and ask questions about things that we think are important, that we've heard local people say to us. Thank you. Thank
you, Jane. Robin.
Yeah, we are starting to get some questions through. First one actually came through in advance. Member of his contact said, "Hello, I would like to know if you're planning to cancel operations again." And this individual had an operation scheduled for March and said they haven't had a date for a planned surgery yet. Okay. Appreciate we can't talk about individual surgery, but can we talk about in general?
Yeah.
Simon?
So we're not planning to cancel operations. We're not doing quite as much operating as we did before COVID. So we're doing about 90% of the operations that we did before COVID. At the moment, we're not planning to cancel any of that. We're planning to carry on. However, part of our intensive care unit surge plan uses some of the theatre areas, so that would lead to a reduction in the amount of operating that we'll be doing. So that will be the key factor around this, but at this moment in time we're planning to carry on with the operations as planned. There is an Dave might want to touch on this a little bit more, but there is a clinical prioritisation order of how patients are brought in. Operation around that, so that might mean some patients who clinicians feel can wait a little bit longer might have to in order to bring in patients sooner who are a higher clinical priority.
Yes, okay. So people will be aware that there's concern about the increase in waiting lists following the curtailment of quite a lot of the activity that happened with the wave one. What we've been doing over the summer and continue to do is to review all of our waiting lists, just to update, to ensure that people are prioritised appropriately in there. And as Simon says, if there's a potential possibility that people can wait, then that may be something that we need to discuss with them. This isn't about taking people off waiting lists, it's just ensuring that the waiting lists are up to date and as realistic and reliable as we possibly can make them. And that's we're doing that in accordance with national guidance, so all of the organisations will be performing that and undertaking that.
But so hopefully that answers the question. The latter point though, and as you say, Rob, we can't go into specific details, but we've got a patient here who was due an operation in March and we haven't given them a new date. So I think if we can get that patient's details, we would certainly look into that.
Yeah, absolutely.
We've got that person's in, like I said.
Okay. Yeah, fantastic.
Follow that up.
A slight follow-up actually. Outside of surgery, we've got about appointments as well. Are we still running outpatients?
We're still running outpatients as we would normally run them, but as we were saying, in line with visiting, we won't want lots of people coming to those outpatients unnecessarily, but in terms of patients and or carers coming with them, we're still running those again at about 90% of our previous levels, but we have no intention to reduce that at the moment. Again, the risk around that is that we've got our workforce and we've got to be able to provide a safe workforce to the emergency care pathway. So that might mean in the future that we might have to change outpatients, but there's no plan to do that at this moment in time.
Although, so just to add to that, I think my understanding is, as you say, volume-wise, we're doing high levels of outpatients compared to previously, but are we still seeing fewer patients come on site for their outpatients? So we've got telephone clinics, we've got virtual appointments. Yeah, so we're finding different ways to do those appointments through telephone clinics and through virtual appointments, and we encourage our clinicians to make sure that's the safest way that patients can be seen within outpatients, and also for patients where they feel that they can be seen in that way to engage in that, because it's a really useful way of keeping you safe, safely away from the hospital while still getting your outpatient care.
Thank you. We're being asked about Tier 3 as an anonymous question. As we go into Tier 3, is the hospital making any changes?
You sort of touched on that, Julie. Do you want to expand on your point?
Sure. So not particularly. We are restricting any entry to the hospital. So if you're not visiting in line with the policy, you won't be permitted entry. All of the coffee areas have been set up so that people sit alone. So if you're coming in as a patient or a visitor, you need to sit within your household bubble or on your own. But at the moment, there are no plans to roll back visiting, but that does rely on people following the rules.
And just building on that, all through the pandemic as an organisation, we've been quite clear about trying to facilitate or allow as many staff as possible to work from home, to work off site. We've continued with that even as the community numbers dropped during the summer months, and my expectation of the Tier 3 announcements will be that we will encourage people to remain working from home if at all possible. Obviously, patient-facing activities, that's not possible, but some of our other members of staff are able to do that.
That actually follows a question we just had in, Dave, so I think you started to answer it. It just says, are staff that live in Nottinghamshire still asked to come into work as normal when we go into Tier 3?
So if they're if they need to be on site, then living in Nottinghamshire would be the same as living in Mansfield, because we're all going to be in tier 3.
So just on that point, as Dave was explaining, we've been pretty consistent now for 7 or so months about recognising that a lot of our colleagues will have to be on site given the nature of their job, but we've got colleagues where it is easier for them to work from home in a flexible way, and we would certainly, we've made a lot of progress around that, and we'd certainly expect, irrespective of the change in tier status, for that to continue. I was just reflecting on the point that Julie made. Whilst people will encounter, whether it's Newark Hospital, Mansfield Community or Kingsmill, will encounter hospitals that feel and look different at the moment, I would hope everyone fully understands the reason why that is. We have taken a series of very difficult decisions over the last couple of months, but we think we're taking a balanced approach here, and everything that we have decided to do is pragmatic and logical. This will only work, going back to the point that Andy was explaining about the importance of recognising collective effort and individual responsibility. As Julie was describing, if we're not seeing at the moment, we're seeing really high compliance within the organisation, both people who work here, patients and visitors. But if we see that compliance begin to deteriorate, and we were to see an increasing rate of COVID in the organisation, it would only mean that we'd have to take further restrictions. So I would urge anyone listening to this to adhere to that and to communicate to their friends and family that we take our responsibility as an employer and as a provider of healthcare very, very seriously, and we need your support to continue to do that.
Thank you, Richard. We've had a question on those lines, actually, just asking what the community can do to support the hospital at the moment. I think that starts that, doesn't it? But anything else on those?
Well, do you want to start with a response to that, Andy?
I can do, Richard. Yeah. So I think it really is about just doing what we know we're meant to do, and we know that, for example, the proportion of people who are isolating when they should do when they've been contacted is quite low at the moment, and critically that needs to be better. So if you have been contacted by the contact and trace system, it's important that you follow the things that you're asked to do. That can only help reduce transmission. The basics are simple, but therefore maybe easy to forget, and I guess we've all been out and about over the last 6 weeks and seen areas where people aren't following the guidance. I highlighted a couple of areas around household mixing, so that means following the rules about rule of 6 and sustaining that outdoors, and also making sure that we're careful around things like school drop-offs. We know there's been some issues. I think there'll be an increasing presence around schools to try and make sure that drop-offs are done safely, to try and keep schools working. That's critical for everyone. It's critical for the kids. It's critical for our staff in the health and care system, many of whom have children at schools, and clearly we need to keep them working. We know that there'll be an increased presence on public transport to try and help people stick to the guidance. So, I think we all know what we need to do. Actually, now is the time to do it for Nottingham and Nottinghamshire, because if we don't, and the rates continue beyond the next 3 weeks at the rate we know they're going to, we will face a very, very difficult winter, and it will increase the difficulties that you've just been discussing on this call, Richard, about maintaining care for everyone. And we think that's really important. We want to keep everybody safe in the health and care system this winter. And I guess the final thing, which I'm sure Julie and Dave will want to pick up on, is flu vaccination. We know that that will give you personal protection. It will help protect your family members, particularly any older family members. And we know that that will decrease the risk of you from COVID, because catching both COVID and flu at the same time in short order, we think will increase the risks for older people. So we're in the midst of quite an active flu campaign this year, and I'd encourage people to take up the offers of flu vaccination. We think that's important.
Thank you, Andy. So anything that colleagues would like to add to that?
I fully support that, and encourage people to to get their flu vaccine. Everyone in this room's had a flu vaccine.
I think the only thing I'd add to it, so as Andy responded to, the question is about what can the community do to help the hospital, and also we can extend that, as Andy was describing, to people who work in the care sector. Andy very clearly laid out a series of practical steps that people can take. I also think there's a series of steps that people can take from a supportive perspective. So as Dave was describing, we will all be struggling in different ways at the moment. Some of us will be managing to cope with this better than others. That's through no fault of other people. But we know that whether it's the impact of COVID on our personal lives or our working lives for the last 8 months, or the evenings now are a lot darker, or other factors at play, this is a difficult time for all of us. And I'm sure people are doing it, but when you interact with people who are professionally caring for you, be it the receptionist or the healthcare assistant or the doctor or the nurse or the pharmacist or anybody in the organisation, and extend that to any organisation you interact with, we do our best, as I say, to take our responsibility as a provider of care very seriously, but we don't always get things right. And the people that you're interacting with who are providing you with care will, just like you possibly are, possibly having their own personal struggles, and just ask people to be very receptive to that as well, please.
We did have another question about flu, actually, so I'll bring that in if I may here. Ian has asked, it says, concerns have been raised about the availability of flu vaccines for staff in hospitals in particular. Do we have any clarification on that, please?
Do you want me to start? There was a coordinated campaign to really vaccinate as many people as possible this year. The biggest flu vaccine program ever, so there was huge demand. To cope with that demand, the release of vaccines and the production of vaccines has been staggered. So we did have a slight hiccup in our supply a week or so ago. We now have vaccine back, and the vaccine clinics were running not far from this room earlier on today.
Do you want to add to that, Julie?
No, I think that sums it up.
So we're just a fraction below 70% of frontline colleagues. If it's the Ian that I know, maybe it's not, there's lots of Ians around, but if it's the Ian I know, one of our governors, we know that Sherwood over many years now has done exceptionally well in terms of its flu vaccine uptake, and I'm certain this year will do even better.
Thank you. I'm conscious we've got Jane from Health Watch with us, and she's got some questions. If I can bring you in at this point, Jane, is that okay?
Yeah, Jane?
Sorry, I didn't hear exactly what you said.
Sorry, Jane. Did you have any questions you'd like to ask, please?
Yeah. So there's a couple of things. We've talked quite a bit about visiting people who are inpatients. I'd just like to understand what the arrangements are for people bringing someone with them to a hospital outpatient appointment. I think you might have mentioned it. I didn't quite catch what you said the arrangement was, because clearly it helps people to make good shared decisions if they're able to bring somebody with them to discuss any sort of diagnosis or treatments with them.
Julie?
Sure. So for most routine outpatient appointments, we're asking patients not to bring anybody with them unless they require a carer or have got significant issues such as mental health, learning disabilities, where they do need somebody with them. If a patient is coming to an appointment where they are receiving a diagnosis, then they will be allowed to bring somebody with them to support them, and the team that are seeing them will let them know that. But for most of our appointments, we're asking that people don't bring anybody with them, and we're trying to do them in a different way so that people can be supported in their own environment as well.
Okay, thank you. Have I got time for another one?
Yes, please.
Yes, please.
Yeah, so this one's, it's not about direct feedback of things we've heard about Sherwood Forest, but recently there's been a report on discharge published by Health Watch England to try and understand what's people's experience of the new discharge pathway that was put in place during COVID. And I know that's happened everywhere, and it will have happened in Sherwood Forest. So effectively that meant people were being discharged much more quickly, and some of the delays that used to exist were removed. But this report found that around 1 in 5 patients felt that they were unprepared to leave hospital. It was happening too soon, and there were instances of people being readmitted because they didn't feel prepared or they didn't feel ready, and some significant issues about the support that was available in the community following these discharges. So I just wondered what, the Trust's kind of thinking about this had been, what your awareness of these issues had been locally, and whether you had any plans to address them.
Shall I start? I think Julie possibly to start, and then maybe over to you, Dave.
Is that all right?
Yes, that's perfect, Julie.
So our integrated discharge team have been monitoring this really closely because they had concerns about the new process and have been supporting that with patients, their families and their carers, and in some cases supporting transfer to care homes, etc., to ensure that patients are handed over appropriately. Alongside that, we're expediting a piece of work to support carers, because actually what we found is that the visiting restrictions, when they were at their most restrictive, meant that people weren't involved in the care of patients as they would do normally, and they play a really key role in preparing patients for discharge. So we are expediting some work around the carer's passport to ensure that carers are appropriately involved in all elements of admission to hospital as well. It's something that's at the forefront of our minds, because we do realise the impact that the restrictions have had on discharge planning, not only for the patient but also for those around them. So our family liaison service, which is hosted by the patient experience team, are developing some key pieces of work around this as well. So I think it's something that we're very much mindful of, and we're doing our best to ensure that patients are prepared for discharge and that those around them are prepared for it as well. As Richard said, that doesn't mean we always get it right. So we have seen some incidents where people report they weren't prepared, but we're working hard to try and address that.
Thanks, Julie. Anything you want to add?
Well, so I thought that was a really good report, and I know Nottinghamshire Health Watch were involved in contributing to it, and I guess the only things I'd just add to what Julie said is that sort of discharge to assess process. It wasn't something that we introduced in March 2020. That's something that we've been trying to introduce really for quite a significant period of time, recognising that hospital is not always the best place for our recovering patients, and actually we can get better at doing the discharge process as a sort of parallel process as opposed to a serial process. I think the stark comments from that report that I really were concerned about were around the 35% or so patients who weren't given a contact or given a contact for follow-up, and I think that's something that we absolutely need to just ensure that we're not missing in terms of our processes. I think Sherwood is quite always very good at liaising with the primary care and various rehabilitation and follow-up processes within the organisation, and we have quite a mature relationship with the whole discharge process in terms of that.
Thank you. You okay with that, Jane?
Yes, thank you.
Thanks for raising those two. Any other questions you'd like to raise at this point?
No, I think the other things I had have been covered by others. Thank you.
Thank you. Robin?
Thank you. Yeah, we've got about 10 minutes left, so I'd like to sort of rattle through some fairly quick ones. Some of this covers old ground we have talked about, but I'm just conscious that people may have joined afterwards, so it may cover some questions we've previously touched on. A couple more about maternity, if that's okay. So we've been asked, excuse me, bear with me, about new mum's mental health from Briar, I believe, concerned that partner had missed out on scans and their mental health position. Is that something that we've considered or are doing anything about?
So that's why we're allowing partners to come to the 12 and 20 week scan, and that's been in place at Sherwood for some months now.
And then can we confirm again, through is another question about any changes to maternity and labour wards? I know you said it before, Julie.
Should I just repeat the maternity
Yeah,
visit
thank you.
bits? Okay. So we are committed to keeping women and their partners together. So that means partners are welcome to attend the 12 and 20-week scan appointments. Partners are welcome to accompany women for induction of labour, caesarean section, labour and birth, and after birth across the maternity service. Both parents have unrestricted access to their babies on the neonatal unit if the baby is admitted. And there is specific individualised care plans that can be developed where couples are having a difficult time, for example, in the early pregnancy unit or any baby loss experiences. So the team are committed to working with people to ensure that our policy is as compassionate as it can be during these really difficult times.
Thank you. We talked a bit about winter. We've had a question to say, is there a plan for how we deal with COVID alongside winter?
Yeah, we have a winter plan, quite a bit of which has been implemented. The winter plan creates about 76 extra beds across Newark here and some providers within the community as well. We've opened quite a few of those extra beds, and we believe that should get us in a good position to be able to make sure we're providing timely care and really importantly not overcrowding in our emergency department, so we can maintain distancing. And so there's a clear winter plan in place, and every confidence that will be delivered.
If we can return a bit to one of the previous conversations about operations, we've been asked if you're worried that you've not heard about your operation, what should you do? So is there anything that actively people can be doing?
I'll have to come back on that one, Robin. I think previously we have had numbers that patients can ring around that, and I just have to check back about what that number is, so we can put something out. We can publish something around that in terms of whether people are worried and who to contact and when.
Thank you. We've also been asked again about appointments and just about how we are doing any prioritising of appointments.
I think again that's a clinical prioritisation of who needs to come to those appointments, as we were talking about in terms of surgery. So there's a lot of work being done by clinicians to understand the relative priority. Obviously that's harder to do with outpatients, because for quite a few outpatients never seen the patient in the first place, so it's a bit harder to do, but clinicians are identifying who needs to come in when, and we'll be allocating our outpatient appointments on a clinical priority basis.
Thank you. We've been asked how our staff are, and obviously how are staff feeling at the moment, and also they would like to thank everyone for working so hard during the pandemic.
Thank you for that. Who would like to pick up on that question? Well, I've asked it once. Do you want to go, Julie?
Right. So I think, yeah, thank you for asking. I think we've touched on part of that. So I think colleagues at Sherwood probably feel in a similar way to the wider population. I think we are worried about, well, as the chief exec, I'm certainly worried about how hard people have been working now for a prolonged period of time. I'm concerned about the pressure that this winter will bring on us. And I'm concerned about the impact that COVID is having on all of our personal lives. So we've been sharing some stories recently about not seeing friends or family for long periods of time, and people at Sherwood hospitals, that's no different to people in the community. So I think we are all struggling from time to time, and I sense from my perspective that I have good days and I have days where I feel less confident than I maybe did 24 hours previously. I think the way into this is the theme that's been running through the conversation today, and we've certainly been trying to communicate and adhere to over the last couple of months, which we are in all of this, we're all in this together, that it's going to be difficult. But personally, I do feel optimistic and hopeful that if we continue to adhere to the guidance that Andy and others have very clearly stated today, both in terms of what it means for us when we're outside of work and what it means when you're in work or you're coming into a hospital. If as an organisation, we've said that we're going to focus on 3 key things this winter that we think are realistic and achievable and important. So they are providing safe care to all patients in the way that Simon described. The second point is being absolutely clear about trying to look after each other and ourselves. So we know that in particular clinical colleagues work long shifts in hospitals, and we have to support them to feel that they can take timely breaks, to ensure that all colleagues can take annual leave so that they're not working for long periods of time. That's the second bit about looking after each other and ourselves, being kind, being compassionate, being inclusive, but also, and I was going to conclude with this, being proud. We all feel very proud of working in this organisation, and increasingly when I speak to and listen to people outside the organisation, people are proud of the quality of care that their 3 local hospitals provide. It's going to be exceptionally difficult this winter. It's difficult every winter, but it will certainly be difficult. But I think we can feel proud about what we're doing, and we need to continue to support each other. And I personally think that we will collectively emerge from this.
Thank you. One more perhaps before we sum up, if that's okay. We've just been asked about sort of exactly how busy we are as a hospital, and are we at full capacity, and is all of that capacity COVID patients?
So no, not all the capacity is COVID patients. We are very busy. We're not quite as busy as we were before COVID was here. I think the worrying thing is the increase that we are seeing in COVID, and that will obviously make us much busier on top of a relatively busy workload on top of that. So I think we're coping at the moment, but we obviously urge the community to help us over the coming weeks to be able to maintain that position.
Thank you.
Thank you. Richard, if you wanted to.
I was going to say sum up, so we're going to quickly go in reverse order. Start with you, Robin. What would you like to conclude with?
I'd just like to say thank you to everyone for taking part in this. It's something we've done now for the 3rd time. I think it's really valuable to hear questions from the public, so please let us know if you've got any comments about it, directly to us in the comms team or anywhere else you can get into, but I'd love to hear your feedback. Thank you, and thank you to you and your team for pulling it together. Jane, thank you for joining us. Anything you'd like to conclude with?
No, a great event, great opportunity for everybody to listen to you guys and what you're doing and ask questions, really support it.
Thanks, Jane. Andy?
Yeah, just thank you for asking me to join, Richard, and thank you to the members of the public. You were absolutely brilliant in Wave 1. I know we can do this. We do have to work together. So thank you for all that you've done, and please try really hard in the next 3 weeks to see if we can get these infection rates down.
Thanks, Andy. Thank you for joining us. I understand you've been on BBC East Midlands today, so you've been very busy this afternoon. Thank you for finding the time for this. Simon?
No, just look after yourselves, look after each other.
Thank you. Julie?
Yeah, thank you for joining us, and the same message as Simon. Just take care out there.
Dave?
Just perhaps I would say that picking up on the themes of the questions we've had about how the staff are, and your point about it is similar to how the community is feeling. It's okay to not be okay, but actually let's all support each other. And I think this is going to be a really challenging time, but pulling together, we're going to get through this all together.
Thank you, Dave. And like Andy, you've been on Gem FM this afternoon.
I've been on the big radio station, Andy.
So thank you for joining us. And finally, as we said, hopefully that's made sense to people. We are going to continue to do these if they are adding value. So thank you to Ian and other members of the public and the community who have asked questions. It won't have been perfect today. Any advice or guidance you can give us, please let us know. We are open for business. We will provide you with safe, timely care. But for us to continue to do that, we need all of our colleagues in health and local authority, and certainly patients, the community, members of the public, etc. We all need to be adhering to what are these very clear guidelines. So thank you for your support, and we wish you all a very safe evening. Thank you.